Hello, my name is Dexter Lee. I'm an associate professor in the Department of Physiology and Biophysics at Howard University College of Medicine. I would like to take this opportunity to thank the organizers, uh, Clintoria and Joseph, for giving me an opportunity to come and talk with you today about my teaching and research balance at Howard University. So, just a little information about myself. I am an associate professor in the Department of Physiology, and I came from a traditional postdoctoral fellowship at the Medical College of Georgia, which was preceded by graduate school at the University of Missouri-Columbia. And during that time, there was a period in which I started to look for jobs, and I felt as if the teaching and research balance at Howard University was great for me and my career at the time. And so, as a faculty member at Howard University, I also conduct research, and my laboratory studies the role of the kidneys in controlling blood pressure over the long term, and I also serve as the Director of Graduate Studies for the department. So roughly 11 years ago, when I joined the faculty at Howard University, the job that was described to me, of course, included three components. And the components, of course, initially considered all to be equal. And the analogy that was given to me was the fact that it is a three-legged stool. And as you can see, each component, research, teaching, and service, is divided almost equally to equal approximately 100%. Over time, and through the discussion with various colleagues, I'm learning, of course, that there are different weight given to different components of the three-legged stool, which of course would be considered for tenure and promotion. And as you can see on your left, the research-intensive institutions, of course, would require more in terms of research effort and much less in terms of teaching and service from the original model that I discussed earlier. And of course, the middle tier schools, we like to call those institutions who are not as research intensive. You can see the proportional changes in the three components. Now, what was important to me in determining my job responsibilities was the fact that Howard University is considered a research-intensive university. However, the teaching requirements for faculty in the College of Medicine is very considerate. So, just to give you an example, I am part of a team of professors who teach courses to first-year medical students. And to give you roughly a size of my institution in terms of class, the freshman class is typically 180 students coming in each year. And as I've mentioned, as a member of the team of professors who teach the students, I am, of course, would not be considered a course coordinator, so I don't follow an entire course, or I don't manage the course a particular semester. However, I am responsible for teaching certain components of physiology, more specifically renal physiology, to the medical students at my institution. And just to give you an idea of the number of hours, we roughly estimate our contact hours anywhere between 85 to 100 per year. And so with that being said, many of you probably are aware that most medical schools are going to the active learning component. And so in addition to the traditional lectures to medical students, there are of course built-in active learning components, which includes small group learning exercises as well as physiology labs. So that is just a brief description or overview of my institution and the responsibilities there within. So with that being said, it was very important to me to quickly recognize that I must divide my year up into parts. And I love this depiction of the calendar on your lower right-hand side. It basically shows the entire year divided into thirds. And as a faculty member, I quickly had to learn that my year, of course, is most effective when I divide it in third and, of course, accomplish the goals that are set out before me. So with that being said, usually I consider the spring, the summer, and fall different parts of my academic responsibility. And as a faculty member at Howard University College of Medicine, we are on a 12-month schedule. So the typical schedule for me, it appears that I have the majority of my teaching and interactions with medical students during the spring, not so much of interaction in terms of formal lectures in the fall. And although I show an approximately 0% teaching in the summer, I do have summer students who are in the laboratory, and so that is, of course, a form of teaching, which is not necessarily counted in terms of tenure, promotion, and appointment. So below that, of course, we see that the spring semester also shows that I do roughly 10% in research, roughly 10% of service. And so I consider the spring semester my teaching intensive portion of the year. And the fall is pretty much equal in terms of research and service, and the same can be said for the summer. And so, as Carissa mentioned, it is very important for you going into this type of job to know that you have a team of mentors and network, which of course can assist in helping you to facilitate this research and teaching balance within your respective institution. And what is also very important for me is to actually write down what I do each week. Even though I may put these numbers on paper, they may look different from week to week, and that's going to be very important in adapting what I do. And so what is also important for me is that during this time of year, especially in the spring and summer, I am able to devote much of my time to teaching in the spring and more of my time to research in the summer. And the fall is usually a recovery period from teaching in the spring, but it's also a preparation time for research in the summer. And I think as long as you are able to identify those periods of the year in which you are on and quote off in certain aspects, it will help your transition into a productive year to be much more fruitful. I wanted to briefly talk to you that even though I'm part of a team of researchers and lecturers for the first year medical students, we are being introduced to a number of tools and software that are designed to enhance the classroom and also designed to enhance the interactions between faculty and students. And so that, of course, will consist of the flipped classroom, in which we are, of course, expected to give information in advance to the students and to discuss in a more open forum what has actually been considered the most important objectives. Recently, there have been a lot of calls and emails from various companies trying to sell apps for the enhancement and the teaching within the classroom. And what is what is very good about this is that you can pick the app or the software that will enhance the teaching in your classroom. But again, if you're part of a team-taught course, then it would have to be a discussion with the coordinators as well as the different lecturers to determine if a particular software or platform would be best utilized for the classroom. So you can imagine that if I am a team of 10 and 10 individuals are coming through the classroom and requiring different license and software, that becomes a bit much. But if one can agree upon these tools, again, that would be utilized to help enhance the classroom, it would help all that is involved. And so other forms of enhancing the classroom that we are experimenting in the graduate professional schools is digital games. It provides, for example, medical students with a fun and structured experience that had an effect not only on their learning but also their understanding of particular needs of patients. One particular program would be Elder Quest. Class interactions are increased, and of course, clear objectives would have to be covered in order for this to be a success. One other a tool that is used in the classroom is the use of simulation. And the simulation, of course, is to imitate the real patients, the anatomic regions or clinical tasks, and mirror real-life circumstances in which medical services are rendered. So this, of course, allows the students to be a doctor without touching the patients. And what is rate limiting with the simulation exercises is the fact that they are fairly expensive and significant resources are needed in order to make this a valuable experience for all students at a particular time, and also the personnel that is needed to monitor these simulation exercises, which of course would be designed to cover the objectives in your lectures. Wearable technologies, again, this, of course, would be a new layer of technology that makes education more realistic and potentially more effective. And if you are considering this as a way of enhancing your classroom and enhancing the interaction between faculty and students, who's going to pay for this? You know, is this a cost that you're going to pass down to the students, or is this something that the institution is willing to fund? And I think you have to go back and look at all of the various softwares, the various games, the various interactions in the classroom, and consider this a very important aspect of bringing technology into the classroom. Last but not least, in the medical school, medical education is changing very rapidly. And there are many factors that will facilitate this, including the changing in the healthcare environment. So as educators, we are asked to deliver information in a very efficient way that will prepare students at a much faster time. And of course, the utilization of many different techniques to accomplish this goal is there are more emphasis being placed on that. So similar changes in the teaching and learning environment are also occurring in the graduate education and other professional students, such as dental students as well. And the roles of the professor and the health professions are changing as well. So I would like to conclude in saying that when deciding upon a job that includes teaching and research balance, you have to know your duties and responsibilities and goals for the entire year and plan accordingly. Of course, you have to develop a plan to accomplish these goals and complete duties and responsibilities. Do not do this alone. Please take the advice of the mentors within your department, within your college, and within your institution. Use your time effectively, as mentioned by Carissa. Most of the time, we would consider our certain service committees within a particular institution as major time sinks, mainly the regulatory committees, And so if you can, coming through the door to avoid those committees, that would be great. And this would be something that will help you, that you can ease into later, that will help with tenure and promotion. If you're going to utilize technology in the classroom, completely understand it before bringing it into the classroom. I think this is one of the major downsides of bringing technology into the classroom without it being pre-tested. And you have to make sure that it's not only capturing the attention of the faculty and more importantly the students, but make sure your objectives are covered when you're utilizing technology. Just don't utilize it because you think it's cool. Determine if sufficient resources and personnel are in place before you introduce various programs, and think about bringing simulation into the classroom to aid in your teaching and research balance. Thank you very much.